During a pediatric trauma, time is of the essence. You want to make sure that your team is prepared to deliver rapid, high-quality care in a stressful situation. Calculating drug dosages during a code situation is a daunting task. There is no room for error. Who has time to look at a tape for this patient who's seizing, mom is frantic, kids O2 sats low, and we're busy doing calculations? How many people here have a method or a technique that en route, when you're here 5 years old, you know, okay, I have a weight and all the medication doses you can figure out in your head? Anyone? We created the Handtevy Method to empower nurses, physicians, and paramedics during a code situation.
Well, before the Handtevy Method, it was a lot more difficult. You had to pull out a measuring device, you had to sit and figure out calculations, and with the Handtevy Method, as long as you know the age, you can figure out the weight, you can figure out how much drug you're supposed to give.
You'll only ever have to remember 5 ages. It's all the odd numbers, 1, 3, 5, 7, 9.
1, 3, 5, 7, 9.
Good. I'm just going to give you a quick scenario. I'm going to introduce Mike Maloof. Mike actually knows the Handtevy Method. Now, Carl, I'm going to have you use the Broslow tape, okay? The only thing I want is the approximate weight of the child, the drug, and the dose that they're going to give for this particular patient that I'm going to give them. Okay, so here's the case. Call comes in, 5-year-old, cyanosis, oxygen saturations in the 60s. Go. Mom is screaming. Kid has stridor. Did you guys see how quickly Mike did this? Okay, every time I've done this scenario, the same thing happens. This dose that was written on this side, using the Broslow tape, is a 10-fold overdose. And you know why? Because the Broslow tape 1 to 1,000 dose is the ET tube dose. It doesn't give you an IM dose. This patient should have received 0.2 milligram.
Medication errors is the #1 cause of injury in pediatric patients, and the Handtevy Method helps alleviate that.
The Broslow tape took 2 minutes and 24 seconds, and Mike took what? 12 seconds. This new method is going to help you determine the weight of a child, what dose of epinephrine, atropine, amiodarone, dextrose, and Valium to give within seconds.
I truly wish that the Handtevy Method was around so it could have prevented some deaths of some children who shouldn't have died.
You got a 5-year-old kid who's got a sugar of 20. How much dextrose do I give him? Easy.
If I didn't have the Handtevy Method, it might take me 3-4 minutes by the time I got the correct drug dose and ML administration.
You're all gonna get a card, and basically it's always there if you need it. So next time you get a call of a 3-year-old drowning, you say 1, 3, 10, 15, 1.5 ml of epinephrine. Very simple.
When a sick child arrives in the emergency department, we work as a team. It's important not only for the physicians to know the right medications and dosages, but also for the nursing staff and the paramedics. And the Handtevy Method does that.
I was able to calculate my medications within 15 seconds.
It's very easy to learn and it's very easy to use.
With the Handtevy, we want to get this technique to happen in a pre-hospital arena. It's going to be a great thing for everyone living in this country. The Handtevy Method will ensure that you have the right dose for the right child every time.